Good afternoon, everyone. Good afternoon, everyone, and thank you for joining. We'll give ourselves another minute or two for everyone to get in, and we will start our meeting for today. Good afternoon again. Welcome to the Ohio Department of Mental Health and Addiction Services quarterly monitoring meeting for our state opioid and stimulant response grant recipients. Um, we will start formally in about 1 minute just to give the last of our folks a chance to get in and get set up. And we are so happy for you to join us today. All right, well, then let's get started. I am Dr. Valerie Alloy. I am Chief of the Bureau of Grants Administration. Next slide, please. And on behalf of the department, I'd like to welcome all of you, our new and returning partners, part of the State Opioid and Stimulant Response Grant, SOS 4.0, and our no cost extension awardees in 3.0. A little bit of housekeeping before we dive right in. Our meeting will repeat tomorrow morning. So for those of you that were not able to join or would like to get other people to hear and repeat the information, we will do that. And on behalf of the department, we want to thank you all for your partnership, your dedication, and all the hard work you do to make sure that Ohioans are receiving the care that they need and that we are able to continue to be successful in our battle against the opioid crisis. As you know, due to all of your hard work in the past iterations of this grant, Ohio has seen an approximate 10% drop in our overdose death rates. And to that, we owe all of you on the call today and many more so much gratitude for all the hard work that it goes into serving this very, very challenging population. Today's call is a required call on behalf of our federal partner, and this is considered one of our formal monitoring opportunities. There are a number of things that we will do, so I'll handle the housekeeping matters first. We want to remind everyone, next slide, please, that the meeting is being recorded. We will have our slides available for this meeting on our website. If we have questions, if you would send those to our SOS 4.0 mha.ohio.gov mailbox. And you can also visit our external portal for other resources and information related to today's call. In terms of our agenda, we will obviously conclude the opening remarks. We think today we're going to go over our project updates and our calendar. We think it's important to hit a few of these key dates as well as introduce our staff. We're going to take a moment to do a little technical assistance on our grants funding management system, also known as the GFMS, disbursements and getting towards year end. We are going to enjoy a presentation from our evaluation partners at the Government Resource Center at the Ohio State University. Data highlights and see what's going on in the evaluation space. And we will have a wonderful community partner presentation so we can look at how things are going, boots on the ground. And of course, we will then do a closing around our resources and things that are available. With that, I'd like to invite Jennifer Ruff, one of our newer staff members, to camera up. Jennifer joins us as our SOS 4.0 Assistant Project Director, and we're so thrilled to have her on deck.
Yes, thank you, Dr. Alloway. I'm excited to be here. Go ahead and go to the next slide, and I can cover some of the project dates and updates. As you know, we're kind of at that quarterly monitoring call for today and for tomorrow. Our next quarterly monitoring call will be in September 15th and 16th. Our project period for 3.0 NCE and SOS 4.0 ends on September 29th. And then September 30th to 13th is when the reporting survey period will open. And that survey should open a little early just so you can see what things will be collected. And then that survey reporting, you'll be able to enter things from the 30th to the 13th. And then I'll go ahead and introduce the SOAR team. We have Cindy West, who is our project coordinator. She is covering the Appalachian and Northwest regions. Terry Davis Stuckey is a project lead for Summit and Twin Valley. Armani Brown is a project lead for Heartland and North Coast. And then Cameron Arif is a portfolio manager for SOS 3.0 NCE. And now I'll pass it over to Armani Brown, who's going to go over some of our SOS project updates. Oh, you're muted, Armani.
Thank you. Sorry. Hi, everyone, and thank you for joining us again. I'm just going to do a brief overview of GFMS disbursements and then a brief overview of doing budget revisions. So for GFMS funding disbursements, we're going to cover the disbursement steps, which is logging into Ohio Pays and updating information in Ohio Pays, and then GFMS system and how to make a disbursement request in the system. So first, you want to log into your OAK supplier via Ohio Pays at ohiopays.ohio.gov. You want to verify that that address matches GFMS. You want to confirm your banking information and then check direct deposit if you want payment to be expedited, because there's also a paper check option as well. In the GFMS system, you'll see on your homepage across the top in red where you'll click on funding, and that's where you'll click on disbursement requests when you want to make a disbursement request. Reimbursements are requested quarterly. Right now, we are in the third quarter, so you can request up to 75% of the grant. We ask that you do not exceed 100% of the line item budgeted amount. And if you need to, we'll cover doing revisions in the next slide. Current request must be in paid status in order for you to make another GFMS request because the system only handles one task at a time. And for a thorough training on making a disbursement request, we've included a link to YouTube that'll go in step by step on how to make a request. Okay, so this is for GFMS budget revisions. Awardees and or subawardee line item budgets changes should not exceed greater than 10%. So in order to make a budget revision, your application must be in NOSA awarded status and all previous disbursements must be in paid status. So when you want to make a revision, you want to email your regional project lead and request that the application be placed into revision. In that email, you want to summarize the revisions that you want to make either on that line item budget tab or on your subawardee budgets. In the GFMS application, once it's placed into revision, you'll want to update the GFMS line item budget tab, and you'll see in the budget revision MHAS column only, you'll want to update those narratives. If you have subawardees, you'll want to update the project documentation tab, and you'll want to upload the new budget for the subawardee under that tab. Please do not delete any existing uploads. You want to verify that your certificate of insurance is current and that you have an active SAM.gov registration number. If you have to update your certificate of insurance, you'll also want to update your signature page and you'll update the dates to make sure that they match the new certificate of insurance dates. And if you have any further questions, you can always email your project leads. And with that, I'm going to pass it to our SOS data coordinator, Dave Conway.
Hi, thank you so much, Armani. Thank you everyone for joining us today. Before I introduce GRC, who will be walking through some of the data with the reports, I do want to give a reminder to everyone who completed the PPR survey and the SORTOR survey. These are required reporting elements as part of the grant. And roughly 30% of agencies did not send in reporting by the due date or complete them at all. So coming up for the fall and end of year reporting, just a reminder that these are required reporting as part of this grant. If you have any questions, you can always reach out to us at Ohio Moss or GRC. And the agencies who did not submit these reports, your program leads may be reaching out in the near future to kind of go over that. So thank you. And I do want to introduce Olivia from GRC, who's going to be presenting as part of our evaluator. Thank you.
Yeah, thanks, Dave. Can you hear me okay?
Yes.
Perfect. Okay. Thanks so much. Hello, everyone. My name is Olivia Wodarczyk. I'm a project management consultant here at the Ohio Colleges of Medicine Government Resource Center. Our team here at the GRC leads the evaluation work for the SOS project, and I'm really glad to be able to have this opportunity to speak with you all on behalf of our team. Next slide, please. Okay, so this is our standard disclaimer and acknowledgement slide. The SOS project is funded by the Ohio Department of Mental Health and Addiction Services through SAMHSA. GRC oversees the evaluation, and the views expressed in this presentation are solely those of the author and do not necessarily represent the official views of Ohio Moss or SAMHSA. Next slide, please. Okay, I'm going to start our presentation today by discussing the mid-year reporting with some GIPR data and the national outcomes measures. Next slide, please. So here's some data at a glance. All of the data shown on this slide and the subsequent slides were collected between October 1st, 2024 through December 31st, 2024. So that 3-month period, October, November, December. For SOS 3.0, there were 991 intakes collected from October through December and 149 discharges. In that same time frame, there were a total of 582 follow-ups conducted for SOS 3.0. Just as a note, these were follow-ups that were conducted from intakes that were done in year 2 of the SOS 3.0 funding. The intakes conducted in quarter 1 of this grant year were not eligible for a follow-up in this period from October through December, since follow-ups only open at month 5 after intake. And this was the first 3 months of the grant period. For SOS 4.0, there were 673 intakes completed from October through December and a total of 31 discharges. Again, there were no follow-ups for SOS 4.0 because, as I mentioned, follow-ups were not yet in window during this time frame. Next slide, please. So now we're going to get into some of the GIPRA data and discuss the national outcome measures, starting with SOS 3.0 data. This bar chart displays the prevalence of different employment statuses among clients for SOS 3.0 at intake, follow-up, and discharge from October 1st through December 31st. At intake, 21% of clients were either full or part-time employed, 33% were unemployed but looking for work, and another 33% were unemployed but not looking. At follow-up, nearly 48% of clients reported that they were either full-time or part-time employed, and 31.9% were part-time or full-time employed at discharge. This is likely due to clients being easier to find for follow-up or discharge that have steady employment. Next slide, please. Among people who reported they have housing at intake, 43% of clients at intake reported that they owned or rented their home. At follow-up and discharge, owning and renting a home and living in a recovery residence or sober living accounted for the highest amount of clients interviewed. This is most likely because clients who live in their own home or are in recovery residence or sober living are easier to locate and conduct interviews with than clients who may have a more transitional type housing, such as living at someone else's house. Next slide, please. And then this table presents the prevalence of the reported reported use of substances at intake, 6-month follow-up, and discharge for SOS 3.0 clients. At intake, 48% of clients, 466 total, reported using substances at least one day out of the past 30 days, excluding tobacco. Cannabis, alcohol, opioids, cocaine, and methamphetamines and other stimulants all had similar reporting percentages at intake, ranging between 17 to 21%. At follow-up, nearly 30% of clients, 170 people total, reporting using substances in the last 30 days, and cannabis was the highest percentage indicated at follow-up. And then at discharge, nearly 16% of clients, 23 people total, reported using substances in the last 30 days. And all the values for the discharge data were under 10, so that data was suppressed for that reason. Next slide, please. And then opioid use disorder, OUD diagnosis, was reported by 64% of clients at intake for a total of 632 people. At follow-up, 62% of clients reported an OUD diagnosis for a total of 357 people. And at discharge, 64% of clients reported an OUD diagnosis for a total of 95 people. This table shows the prevalence of clients receiving treatment in the past 30 days among clients with an OUD diagnosis at intake, 6-month follow-up, and discharge. Buprenorphine was the most reported OUD treatment at all 3 GIPRA touch points. Next slide, please. Okay, now we're going to turn to SOS 4.0 GIPRA data and the national outcome measures. This bar chart displays the prevalence of different employment statuses among clients for SOS 4.0 at intake and discharge from October 1st through December 31st. As a reminder, again, there's no follow-up data for SOS 4.0 in that time frame because no follow-ups were open yet. So at intake, nearly 25% of clients were either full or part-time employed, 34% were unemployed and looking for work, 25% were unemployed but not looking, and 13 reported unemployment due to a disability. At discharge, the majority of clients, nearly 53%, reported a status of unemployed and looking for work, 21% reported unemployment due to a disability, and another 21 reported that they were unemployed and not looking. Just over 5% reported part or full-time employment. Next slide, please. Among people who reported that they have housing at intake, 30% of clients at intake reported that they owned or rented their home. 23% reported living in a recovery residence or sober house, and 21% reported living in someone else's house, and then 20% reported residential treatment. At discharge, living in residential treatment accounted for the highest amount of clients interviewed, with a total of 87.5%. This is most likely because clients who were in residential treatment are easier to locate and conduct that discharge interview with when they're being discharged from the SOS services. Next slide, please. Okay. And then this table presents the prevalence of the reported use of substances at intake for SOS 4.0 clients. At intake, 40% of clients, 266 total, reported using any substances at least one out of the past 30 days, excluding tobacco. Cannabis was the most reported substance used at 20%. And then as a note, the discharge column was removed in this table due to the N value being lower than 10. So we suppressed that data as well. Next slide, please. And then an opioid use disorder, OUD diagnosis was reported by 58% of clients at intake for a total of 390 people. And at discharge, 74% of clients reported an OUD diagnosis for a total of 14 people. This table shows the prevalence of clients reporting receiving treatment in the past 30 days among clients with an OUD diagnosis at intake and discharge. Buprenorphine was, again, the most reported OUD treatment at intake and discharge. Next slide, please. Okay, now I'm going to discuss some important reminders and upcoming notices for data collection and reporting. Next slide, please. So as it relates to required reporting, here are some reminders about the GPRA, otherwise known as the Government Performance and Results Act. GPRAs are collected with clients at 3 points in time. Clients receive a GPRA at intake of services, which is the baseline GPRA. Clients then receive a follow-up at 6 months after intake, with a 3-month period to complete that follow-up. And then sites are expected to achieve a minimum follow-up rate of 80%. So you should be reaching 80% of those clients to complete that follow-up as a minimum. And then finally, clients must receive a discharge from SOS services. Clients should be discharged when they are done receiving SOS services, if their 30 days have elapsed and they are unable to be found, or if the grant period is ending. All clients for SOS 3.0 need to be discharged when SOS 3.0 ends by the end of September. So I just want to say that again. All clients for SOS 3.0 need to be discharged when SOS 3.0 ends by the end of September. I also want to make a quick reminder that all GPRA collectors need to be updating and reviewing the information in your client's locator form anytime you interview them or anytime their contact information changes. We use this information in the locator form to send them their gift card when they complete their 6-month follow-up. So it's important that this information is correct. We are finding that some of the physical addresses listed for receiving a gift card sometimes can be incorrect or incomplete, resulting in the physical gift card not reaching the client. So please be sure to check that the information in the locator form is correct and include important things like the apartment number if that information is necessary. We also want to remind people that there are electronic gift card options available for clients. So they can receive an electronic gift card either via email or text message. If you choose one of those options, just be mindful that you need to include the email or their phone number that can receive SMS text in the locator form as well. If you have any more questions about the GPRA and this data collection with clients, I'll have more information at the end of my presentation about our training series and some of the resources that we provide to the field. Next slide, please. Another required component that Dave was mentioning earlier of the SOS grant is the quarterly reporting. There are 3 reports that the GRC fields quarterly, and they are the SORTOR instrument, the non-GPRA instrument, and the mid-year, end-of-year performance progress report. The SORTOR instrument is a report that collects information on prevention, education, and harm reduction services that your organization may do with SOS funding. This is required for all grantees. The non-GPRA instrument is a report that only applies to a certain subset of grantees. And these are for grantees that do prevention programming that serve clients that do not receive the GPRA. For this reason, they report their data to us in the non-GPRA report, and those programs report numeric and open-ended data in the non-GPRA to us. And then finally, the mid-year and end-of-year performance progress report, referred to as the PPR, is also required reporting for all grantees. This report is fielded twice annually at the end of quarters 2 and 4. In this report, grantees report their impact stories, their major accomplishments, any challenges you may have faced, and other programmatic stories about your funded projects. And then again, I want to note that the SORTOR and PPR are required reporting for all grantees. If you are funded by your local board, you are to report this data to the board directly. Then the board will then compile all the information they receive from their subawardees and submit on behalf of their subawardees. Next slide, please. Okay, as quarter 3 is currently wrapping up, the quarterly report is going out to the field today. Again, this is required reporting for all grantees for both SOS 3.0 no cost extension and SOS 4.0. This quarter, we are fielding the SOR report for all grantees and the non-GIPRA for the subset that report applies to. The report will remain open for responses to be submitted through Monday, July 14th. So again, that closes on Monday, at the end of the day on Monday, July 14th. The report goes out today with a REDCap link from our email address, which is soseval@osumc.edu, and we will be sending frequent reminders from that email as well. All of the emails that you get about quarterly reporting will contain the report link, a PDF of each of these instruments, and then a guidance document. And this guidance document has directions for the reports, how to navigate through the REDCap link, and then answers to the most frequently asked questions. So please look at that resource. And then if you have questions about the reporting, we are doing something new this quarter. We are hosting 2 question and answer sessions on June 20th from 1 to 2 p.m. and June 30th from 9:30 to 10:30 a.m. These will be drop-in sessions where you can join, ask any questions you have, and then leave. Registration links for both of these sessions can be found on our reporting page on our website. And they're also linked in the slides. Next slide, please. Okay. And then as we look ahead to Q4, I want to preview the quarterly reporting for the end of the grant period. Again, this is required reporting for all grantees for SOS 3.0 no cost extension and SOS 4.0. In Q4, we will be fielding the SOR report for all grantees, the non-GIPRA for the subset that report applies to, and then the end of year performance progress report for all grantees. The report will be fielded from September 15th through October 13th, and it will close at the end of the day on October 13th. As I mentioned, this will go out via our email, soseval@osumc.edu, and it will contain a REDCap link. We will also be hosting Q&A sessions in Q4, and we'll have more information on those as the time gets nearer. Next slide, please. And then finally, to wrap up our reporting, our team sends out biweekly reports with critical information such as your intake data, your follow-up rate, which GIPRAs have their follow-up window open, and other important details. All awardees directly funded by Ohio Moss receive a report from GRC. If you are board funded, your report goes directly to your board, and you may receive your agency-specific report from the board. If you have any questions about the biweekly reports, we have a technical assistance form that you can fill out on our biweekly reporting tab on our website. Next slide, please. Okay, and to close out my presentation, I'm going to let you know about some helpful resources, how GRC can support you, and how you can get a hold of us. Next slide. GRC recently rolled out our new field guide on GIPRA data collection and follow-up. This is a document based on multiple SAMHSA resources that includes strategies, tools, sample scripts, best practices for intake, staying in touch with clients, completing follow-up, and discharge. You can use the QR code on the screen to get to the guide directly, or you can visit our website and find it on our resources tab. Next slide, please. And then, as always, GRC is here to provide your staff with up-to-date guidance and training. We have a 2-part training series that is required for all staff that work on the SOS project. The first is GIPRA data collection, which goes over how to complete the GIPRA required interview. That is done by our subject matter expert, Dr. Margaret Bachman. And then the second training is the GIPRA data entry training, which goes over how to enter a GIPRA interview into iPortal and how to navigate through that site successfully. Both trainings are offered twice per month, and registration dates are on our website under the training tab. We also recommend that seasoned staff take these trainings annually as a refresher because we are frequently updating our training materials. Next slide, please. Okay, and finally, you can contact us anytime at our SOS eval inbox. Again, the email is soseval@osumc.edu. There's also a contact us button on our website that will direct you to our inbox as well. So please also visit our website for all the resources that I've been discussing in this presentation. We recommend that you bookmark our website for future reference. And then thank you. I will turn back to the team at Ohio Moss to keep things moving.
Hi, Olivia. We did have a question that came in, and I wondered if maybe you could assist. It said, would we be aware if we did not submit reports, were there notices given to leadership?
I'm sorry, can you repeat that?
Would we be aware if we did not submit reports? Were any notices given?
I'm not sure I understand the question.
I think if the reporting during the reporting period, if they didn't submit, are they made aware?
are they made aware? We send out frequent reminders. We've done targeted reminders in the past to organizations too that have not filled it out yet. But I would recommend that teams coordinate together and ensure that they know who is responsible for reporting. If there are multiple team members that receive our emails and aren't sure who at their agency should be handling the reporting, they should be coordinating. And then they can also reach out to us if they have questions if a report has been submitted on their agency's behalf.
Okay, great. Thank you.
Thanks.
Okay, and I'll go ahead and introduce our community organization. We have Community Counseling Center of Ohio, Courtney Whitbread, who's our Community Supports Program Supervisor. She's overseeing the Maternal Opiate Medical Support Project and servicing our highest need mothers and their children. So I'll go and pass it over to Courtney.
There we go. Okay, hi everyone. I hope everyone can hear me too. Okay, so my name is Courtney Whitbread, and I am the program supervisor at Community Counseling Center in Ashtabula. I'm a licensed social worker, and I have a chemical dependency license. I'm also a prevention specialist as well, so I wear many hats. Okay, so next slide, please. Okay, so this is just a brief overview of our team with the MOMS program. So there's myself, this program supervisor, Michelle Hochran is our clinical supervisor for therapeutic recovery. We have Kim Boyd, our director of adult recovery services, and then we have our case manager for the MOMS program, Elizabeth Babo. Next slide. And then we also have 3 peer supports that work with our MOMS program. We have Kirsten Kula, Megan Brady, and Caitlin Jones. Like I said, each mom within our program is assigned peer support to work with throughout their time spent in the program. And then all of the moms see Elizabeth for case management. Next slide. I think I might actually have control. Okay, so a little background of the MOMS program. MOMS stands for Maternal Opiate Medical Supports. And this was Ohio's response to the growing needs of pregnant women with opiate use disorders. So there was notice or an increase in fetal and non-fetal overdoses throughout the years, and the number of pregnant women receiving treatment for substance use has increased. So Ohio implemented this program in 2013 to provide services and support this population as opiate exposed infants were increasing in Ohio's hospitals. So some of the goals of the program is to improve maternal and fetal health outcomes, to improve family stability and reduce cost of neonatal absence syndrome, NAS, and provide treatment to pregnant mothers with opiate use disorders during and after pregnancy. And so this MOMS program started as being for pregnant women with an opiate use disorder, and later this has also opened up to stimulant use disorders as well. Another goal is to integrate care coordination across various providers. So these services listed are some of the stuff that we can offer, that we offer at Tri-C Community Counseling Center. We have MAT, we have mental health and substance use treatment. We offer case management that can provide supports for housing services. We offer peer support, and then we offer supported employment program as well. But we do, with Elizabeth, our case manager, she does provide coordination and resources to other for physical health as well. So all of the appointments while you're pregnant to and from the doctor, and getting ready for when the baby is born, and then postpartum appointments as well, providing that care throughout pregnancy and postpartum. Other goals are to, like I said, to improve birth outcomes and reduce neonatal intensive care unit stays and costs from NAS, maintain a continuum of health care services from prenatal to postpartum, as I mentioned, provide health and wellness education, and provide recovery support and community. So some of the qualifications for the program is a self-reported or diagnosed history of a substance use disorder, as I mentioned, opiate use or stimulant use. Pregnant or infant is younger than 4 months old, and I do believe this opened up to until 12 months postpartum recently. And then for our program, to live in Ashtabula County. And then the program services do end once the child reaches 2. And then the mom does not have to be a client of Community Counseling Center to receive services from the MOMS program. We do have a few moms that do get other behavioral health services from other agencies in the county, and then are part of our MOMS program. So how to refer a mom to our program. We care. So you call Community Counseling Center. I have our phone number listed, and we ask to be connected to the MOMS program. We schedule an intake. That one doesn't make sense. I messed that up. But we schedule an intake, so you can reach out to myself. You can reach out to Elizabeth, our case manager, or one of our peers. And the case manager and our peers are primarily the ones that do the intakes. During that intake, they do the GIPRA, they sign all of the consent forms. Elizabeth conducts a needs assessment with them to figure out, do they need to be connected to like housing resources? Do they need to connect with the parenting class? What does the mom need to help make them successful in their recovery? Then, reiterate program information with a brochure. My slides kind of got my hair shifted up. And then other surrounding moms, Ohio County MOMS programs. So these are specifically counties that offer MOMS programs around Ashtabula County, Trumbull, Mahoning, Summit, and Stark County. And then there's other locations we can look into as well. So some of our entry points that where do our referrals come from? So they can come from the hospital through the emergency department, or they can come from a primary care doctor. A big majority of our referrals do come from the child welfare system. So we do get a lot of referrals from CSB, from the START program, social services such as housing resources. Catholic Charities will refer moms to our program, community action, those kind of services, legal services, OBGYN, addiction and behavioral health, so other mental health or substance use agencies. And then, of course, others, churches, family, friends, self-referrals. A lot of the moms in our program, are referred, by word of mouth from other moms who are also in the program. So kind of staying connected with each other in that way. So what our program offers is we do care coordination across healthcare providers. So a big piece is that we do not have a birthing center in Ashtabula County. So we help our moms, find, a birthing hospital, in other counties, and help with that coordination, getting there, coming up with that plan of what that looks like when the baby's born, or when the baby is ready to be born. So we do a lot of coordination with that. Also care coordination within our own agency. We have, like I said, we have counseling services, we offer MAT, we offer psychiatry services, and we do have a supportive employment program at Community Counseling Center. So a lot of coordination with providers at our own agency as well. Connections to community resources. So as I said too, our case manager, Elizabeth, she will provide connections to resources in our community, such as housing resources, or transportation, resources to transportation, legal services, getting people just whatever anyone needs to be successful in their recovery. Having a baby and is a big stressor. So if there's anything that we can connect people to just ease the stress a little bit, we'll find a resource for it. We do offer a monthly luncheon, and this provides recovery and community. And through that we invite all of our moms to come into a luncheon, and they just talk. We just have an open discussion, about different things that are happening, and giving the women in our program an opportunity to connect with one another. And maybe you're struggling with something, I'm struggling with something, let's talk about it. Or I have advice for you, and you might have advice for me. It gives people a chance to connect. We do offer at our luncheon, we do have education and guest speakers. So Elizabeth, our case manager, she'll provide an educational resource. We've talked about water safety. We've talked about other different things as far as like health related things. We do have guest speakers that have come in. We have a local family doctor who's currently retired, and he likes to come in and talk to our moms about different things. We brought him in. He's recently talked also about water safety and about vaccines, and ages to get vaccines, and different things that not a lot of people are aware of. Other guest speakers would include those community resources, housing resources. We've had people come in from our June luncheon was last week. We had a speaker come in from the YMCA, and she talked about programs that the YMCA offers and childcare at the Y, and getting a membership at the Y. They had financial assistance, getting people set up with that. So that was a good opportunity for our moms to hear about a community resource, and also get some community connection. At the mom's luncheon, you can also receive baby items such as diapers and wipes and a gas card. Those are just incentives that our program offers. So, or below that, items for babies, diapers, wipes, diaper bags with travel content. Those come when you are initially referred into the program. We get you your mom's items, or when the baby is born, we get these things to you. You can pick a crib or a crib mattress or a pack and play, a car seat, stroller. Back to the gas cards. So we do and gas cards, diapers, and wipes. We do those twice a month. You get the extra diapers and wipes at our additional diapers and wipes at our mom's luncheon. So the gas cards are a good incentive, and also to help you get to all of the various appointments that you have. So we're thinking for the baby, during pregnancy, there's so many appointments you get to for the baby, and then even after, you have all of the checkups that come after the baby is born. And then when you're in treatment, you have various appointments as well, especially if you're connected to different services such as counseling or MAT or psychiatry. There's so many appointments that these moms have to get to, and that gas card is a good help to get them there. So currently we have one of the largest moms programs in Ohio. We started this program at a community counseling center in 2019. It's still running. We have served 76 moms and 78 infants, and that number might be a little higher just with in 2025. In 2024, 16 moms were served, and that number is aside from that. Currently, I did some research before coming on here, and we do have 8 new moms so far in 2025 that we've served. Some of them have had children, some of them are still waiting for their children to be born. So this is just a little bit of data just based on these numbers up here. We've discharged participants engagement rate. So this is based on 40 participants that we've kind of had a full range of data for. Just over time, things people have come in and out of the program, and things fall off, and we have to re-pick them back up. So based on those 40 participants, we've had 65% of them completed the program, 23% have disengaged, and 12% are other. So maybe what that other looks like is maybe they moved out of the county, or the mom passed away. So that's what that other category is. And then our active participant engagement rate is based on the 36 participants. Response to monthly outreach, we've had 97%, and then no engagement in the last 3 months is that 3% sliver that you see there. So additional stats is, so our data is based on a sample size of 39 moms. So like I said, this is the moms that we've had a full collection of data for. Of these 39 moms, 41 infants were born. So those infants diagnosed with NAS, we've had six infants diagnosed with NAS. Out of the 41, we've had 35 that have not. And during out of these 6 infants was on MAT. 5 of them were. 1 of them was not. And then when did the mom enter the program? 1 mom entered the program in the 2nd trimester. We had 2 in the 3rd and 3 postpartum. And then on this side, the infants that were not diagnosed with NAS, we've had 10 moms that were on MAT and 25 that were not. A majority of moms do enter our program postpartum. And so, like I said, a goal is to increase the number of women who start the mom services during their pregnancy to provide support over a longer period of time before that infant arrives. And another goal that we have is to reduce the fear and stigma against pregnant mothers who are struggling with addiction. And then, so that's just a little overview of what our moms program is and a little bit of the things that we do. This is just my contact information. If anyone has any other questions or any comments, concerns, etc., this is just my information of where you can reach me. And then I did have a question. If anyone has any questions, I'm happy to answer. Thank you.
Thank you so much, Courtney. We're just waiting to see if there's a question that pops in while you're here, but we appreciate that wonderful tour of your program and understanding how this work is protecting some of our most vulnerable Ohioans, pregnant persons, their unborn children, and their newly born children. So thank you so much. It's a complex program. These clients present complex medical needs, and we absolutely appreciate all the work that you and all of our moms projects do around the state. As we start to turn the corner on today's meeting, I'm not seeing any questions come in for you just yet. We want to take a moment and remind everyone where our resources are. We do have an SOS website on the Ohio MOS portal where you can see our helpful hints for the GFMS, our allowables reference guide. We will post our slides there. And then, of course, we mentioned the mailbox. One question that we are getting a lot is relative to the 2nd year funding for SOS. What we'd like to say at this point is that we are looking to see some guidance coming to the field in July to let us know about the approach that will happen for the 2nd year of the SOS 4.0 grant. We acknowledge that standing up a brand new portfolio, as we did for the 4.0 round of funding, takes a lot of runway. It takes a lot of effort on behalf of all of our partners. Once again, thank you, thank you. We understand what it takes to know that you're funded, to gear up programs, to hire staff, to engage clients, to retain clients. So we understand all of that work, and we'll be looking with that as our informing the next round of decisions for the second year of the portfolio. So look for some communication in July around what the department will be doing in that space. To conclude, I just want to remind you, I was looking at the question that we got, how would we be aware if we did not submit reports? I appreciate both Olivia's response. It's really incumbent upon our programs to know that you should be submitting your reports, to reach back to your program managers and coordinators to verify that your reporting is being made. And as we scrubbed our data, that's when we became aware of the large number of grantees that had not submitted that required reporting. So we will be doing outreach as well to the programs to let you know that we did not receive that mid-year report. At this time, I invite any additional questions about the project to our chat, and we will put together a small FAQ. And we want to thank you again for your partnership, your dedication, your grace, your patience, and wish everyone the best of health as we continue to do what's right for our clients and what's needed for the citizens of Ohio. Thank you so very much.